Hi there, my name is Natalie and I will be demonstrating the box and block test in this video. The purpose of the box and block test is to measure gross manual dexterity, upper extremity function and coordination. It is known to be effective in a range of populations such as stroke, traumatic brain injury, spinal cord injury and multiple sclerosis. It can be tested on a range of ages including children from 6 to 19 years, adults from 18 to 64 and the elderly of 65 plus. Although there is no official translation of the tool, countries such as Italy and Sweden have adapted this tool for assessment in stroke patients. The ICF domain of this assessment tool is activities. Clients' gross motor skills are impacted when they have a stroke, which limits their ability to perform activities of daily living. We will now look at a case study of a patient with a stroke. John is a 40-year-old stroke patient who has been discharged from rehabilitation. He experienced a left MCA infarction which resulted in a right-side hemiparesis. He is married with 3 children and has an office job. After a 5-week rehabilitation program, he was discharged with reduced strength and dexterity in his right upper limb, causing reduced balance, upper limb function and fatigue. John was discharged home with minor environment modifications including a shower chair and grab rails and a physiotherapy home exercise program. Currently, he is at home and would like to resume his usual domestic tasks, such as doing the laundry and preparing some meals to ease the burden on his wife. Now we would look at how to administer this assessment tool. This test typically takes up to 5 minutes to administer. The equipment required are a stopwatch, a wooden box, a partition, and 150 wooden cubes or blocks that are 2.5 centimeters in length and width. Before beginning, it is important to receive consent from the client. Explain simply and clearly to the client the purpose of the assessment and why it will be used. Documenting consent through a written form is important, as they can refer back to it when needed. We will now begin the administration of the box and block test. Clients are seated at a table facing the box. The box should be oriented lengthwise and placed at the client's midline, with the compartment holding the blocks on the side of the hand being tested. Explain to the client verbally that the blocks will need to be placed one by one into the empty compartment, with their fingers crossing the partition. Provide a demonstration. Inform that their arms should be placed on both sides of the box before beginning, and when the timer begins you will say start and then they can begin. Let the client know that holding 2 cells at one time will only count as 1. Set the box up in front of the client. Let them know that a 15-second trial can be done first. After the trial, begin the test with their dominant hand. Ensure you are facing the client to observe them during the test. After 60 seconds, tell the client to stop and count how many blocks they have successfully transferred to the second compartment. Using the test form, write down the number of blocks they have transferred. The client repeats the same procedure with their non-dominant hand. It is important to ensure that the compartment with the blocks are placed on the side being tested. The client begins the test after you say start. After 60 seconds, tell the client to stop. The blocks will be counted and documented on the form. Explain to the client that these are their scores and this can be used to compare future scores when the OT does an evaluation of their recovery. Now we will talk about the scoring. In this test, higher scores indicate better manual dexterity and lower scores show impairment. This is the normative data for normal children established in 1985. This is the adult scores. These scores are used to compare the client's scores with those of normal adults. The average scores on the box and block test decrease with older age. For the client John, his scores will be compared to the 40 to 44 years age range, where average scores shows an average of 83 for the right hand and 80 for the left hand in normal male adults. Occupational therapists can use this tool as part of initial assessment of clients' gross manual dexterity. It can be repeated as a means of evaluation. I hope this video provided a clear explanation of the box and block test. Thank you so much for watching.